Hello everyone, this is Mina Beatrice. Today I'm talking about my unique case. I'm presenting my unique case, which is interesting to me. And first time I see like a fracture in the clavicle. That's why I choose this case. I had a patient came for the clavicle examination. The patient chief complained reason for the examination after they give him the instruction to change from Western up. The reason for the examination is status post fall, work injury, lost his balance, started to fall forward. He put out his arm to break his fall and come down hard on his left arm. He felt a sharp pain near his left shoulder and know immediately that he had injured something. It was a fracture in his left clavicle, and he had a surgery on December 5th 2015. Today he comes in today is July 11th 2017, still continue complaining of the left shoulder pain. And the most significant medical history: trauma, fall while he's doing the job, pain in the left area, difficulty moving the arm, swollen tenderness along the clavicle, increased pain when trying to move the shoulder or arm, cracking sensation when trying to raise the arm. Level of the pain from 1 to 10 was 9. Suspected the fracture and had a surgery on 12 and December 5th 2015. As we see right now, the clavicle, the fracture of the clavicle. The clavicle is a bone that runs horizontally between the breastbone, the sternum, and the shoulder blade, the scapula. The clavicle is also called the collarbone. Helps connect the arm to the body. You can feel it by touching the area between your neck and your shoulder. Most clavicle fracture happen when someone falls onto the shoulder or outstretched hand, putting enough pressure on the clavicle to make it fracture or snap. Most clavicle fractures heals on their own if the arm is probably immobilized in a sling and the injury is treated and with physical therapy. Sometimes, as in this case, like as in my case, the clavicle injury may need surgery, which is the patient had when it gets displaced or break particularly severe. The severely displaced component comminuted the fracture may require surgery to realign the bone fragments and hold them in a place while the bone heals. This is typically done by the inserting special screwed into the bone, or by attaching the metal plates to the outer surface of the clavicle. In general, the screws and the plates will not removed once the bone has healed, unless they're causing irritations. As you see here, there's a chromion process, this one a chromion clavicular joint, and this one is sternoclavicular joint. So this is the clavicle, this is the body, and this is the injured in the body of the clavicle. We took a two positional radiographic procedures, two images. First one AB erect, and the second one AB axial. The century gone for both of them the same thing to mid the clavicle. SID 40 to 44 collimation ensure that the both the AC, the acromioclavicular joint, and the sternoclavicular joint included. The second one, the AB axial, clavicle. I just only angled the 15 to 30 cephalad, and the calamission, same thing. You should be ensure that the both AC and the sternoclavicular joint included. Here is this electronic marker. I forgot to put it my marker, which is wrong. I have to put it. Calamission is to open, to open calamission. For the radiologist report, the radiologist report is status post ORIF of mid-to-distal clavicular fracture with the plate and the screws. The fracture appears healed. ORIF means open reduction and internal fixation. Is a type of surgery used to stabilize and heal a broken bone. Open reduction, orthopedic surgeons reposition your bone pieces surgically back into their proper alignment. Interfixation refers to the method of physically reconnecting the bone and use the special screwed and plate or wires or nails to position the bone correctly. Their acromioclavicular joints and the sternoclavicular joints and unremarkable, not particular interesting or not in particular interesting or surprising. Impression status post ORIF of metadistal clavicular fracture with the plate and the screws. No changes from to December 5th 2015. And also after the surgery, the doctor will often prescribe a therapy to help the regain movement and strength in the shoulder. Typically, therapy will start with the gentle motion exercise, and strengthening exercise will be added as the bone heal. Also as in my conclusion, as I learned from my case, in this unique case, I have learned to not rush to do the procedure. Don't grab the arm and to do it, and position him like physically. Try to communicate with him, because especially the patient feeling pain. Although we have all patients history, so from now on communicate and will provide good patient care. It might be fracture, so positioning him, not try to move the arm. My mistakes I did in the procedures, I forgot about my marker, so the text use the electronic marker. My calamission was to open. That's it. I hope deliver something to you guys. Enjoy it. Thank you.